Hello everyone, this is Kartikeya. Welcome to my channel Rimcat. Today I am going to say about the nose, third part of the sensory organs. Please watch the complete video. First, what is nose? The human nose is the most protruding part of the face. It bears the nostrils and is the first organ of the respiratory system. It is also the principal organ in the olfactory system. The shape of the nose is determined by the nasal bones and the nasal cartilages, including the nasal septum, which separates the nostrils and divides the nasal cavity into two. On average, the nose of a male is larger than that of a female. The main function of the nose is breathing, and the nasal mucosa lining the nasal cavity and the paranasal sinuses carrying out the necessary conditioning of the inhaled air by warming and moistening it. Nasal conchae, shell-like bones in the walls of the cavities, play a major part in these processes. Filtering of air by nasal hair in the nostrils prevents large particles from entering the lungs. Sneezing is a reflex to expel unwanted particles from the nose that irritate the mucosal lining. Sneezing can transmit infections because aerosols are created in which the droplets can harbor pathogens. Another major function of the nose is olfaction, that is, the sense of smell. The area of olfactory epithelium in the upper nasal cavity contains specialized olfactory cells responsible for this function. The nose is also involved in the function of speech. Nasal vowels and nasal consonants are produced in the process of nasalization. The hollow cavities of the paranasal sinuses act as sound chambers that modify and amplify speech and other vocal sounds. Smell. The sense of smell is transmitted by the olfactory nerves. Olfactory nerves are the bundle of very small, unameliorated axons that are derived from olfactory receptor neurons in the olfactory mucosa. The axons are in varying stages of maturity, reflecting the constant turnover of neurons in the olfactory epithelium. A plexiform network is formed in the lamina propria by the bundles of axon that are surrounded by the olfactory ensheathing cells. In as many as 20 branches, the bundled axon cross the cribriform plate and enter the overlying olfactory bulb, ending as glomeruli. Structure of the nose. Several bones and cartilages make up the bony cartilaginous framework of the nose and the internal structure. The nose is also made up of types of soft tissues such as skin, epithelia, mucous membrane, muscles, nerves, and blood vessels. In the skin, there are sebaceous glands, and in the mucous membrane, there are nasal glands. Bones. The topmost bony part of the nose is formed by the nasal part of the frontal bone, which lies between the brow ridges and ends in a serrated nasal notch. A left and a right nasal bone join with the nasal part of the front bone at either side, and these at the side with a small lacrimal bones and the frontal process of each maxilla. The internal roof of the nasal cavity is composed of the horizontal perforated cribriform plate of the ethmoid bone through which pass sensory fibers of the olfactory nerve. Below and behind the cribriform plate, sloping down at an angle, is the face of the sphenoid bone. Cartilage. The nasal cartilages are the septal, lateral, major alar, and minor alar cartilages. The major and minor cartilages are also known as the greater and lesser alar cartilages. There is a narrow strip of cartilage called the vomeronasal cartilage that lies between the vomer and the septal cartilage. Muscles. The muscles of the nose are a subgroup of the muscles of facial expression. They are involved in respiration and facial expression. The muscles of the nose include procerus nasilis, depressor septi nasilis, levator labili superosis, aquae nasals, and the obricularis osis of the mouth. As all are of the facial muscles, the muscles of the nose are innervated by the facial nerve and its branches. Nasal cavity. The nasal cavity is a large internal space of the nose and is of two parts, the nasal vestibule and the nasal cavity proper. The nasal vestibule is the frontmost part of the nasal cavity enclosed by cartilages. The vestibule is lined with skin, hair follicles, and a large number of sebaceous glands. A mucous ridge known as the limen nasi separates the vestibule from the rest of the nasal cavity and marks the change from the skin of the vestibule to the respiratory epithelium of the rest of the nasal cavity. This area is also known as mucocutaneous junction and as a dense microscalature. Blood supply. The blood supply to the nose is provided by branches of the ophthalmic, maxillary, and the facial arteries. Branches of the carotid arteries. Branches of these arteries anastomose to the plexuses in the under the nasal mucosa. In the septal region, Cassiba's plexus is a common site of nosebleeds. Drainage. Veins of the nose include the angular vein that drains the side of the nose, receiving lateral nasal veins from the alae. The angular vein joins with the superior labial vein, and some small veins from the dorsum of the nose drain into the nasal arch of the frontal vein at the root of the nose. Nerve supply. The nerve supply to the nose and paranasal sinuses comes from two branches of the trigeminal nerve, the ophthalmic nerve, the maxillary nerve, and the branches of these. In the nasal cavity, the nasal mucosa is divided in terms of nerve supply into a back lower part, postero-inferior, and a frontal upper part, antero-superior. The posterior part is supplied by a branch of the maxillary nerve, the nasopalatine nerve, which reaches the septum. Lateral nasal branches of the greater palatine nerve supply the later wall. Diseases. Allergic rhinitis, an inflammation of the membranes lining the nose. Cerebral spinal fluid leaks. Chronic sinusitis with polyps, that is an inflammation of the sinuses that lasts more than 12 weeks and is associated with nasal polyps. Chronic sinusitis without polyps. Difficult infections and deviated septums. Fungal sinusitis includes allergic fungal sinusitis and fungal ball plus acute or chronic invasive fungal sinusitis inverting papilloma. Benign tumors that form inside the nose. Meningocephalocele, when the lining of the brain and or brain tissue protrude through an opening in the skull. Nasal fractures, nasal masses and nasal tumors. Nosebleeds. Triad asthma, a clinical syndrome defined by three conditions that exist together, that is asthma, aspirin sensitivity, and nasal polyps. Treatment. Antibiotics. Antibiotics are standard treatments for bacterial sinus infection. Nasal decongestant sprays. Topical nasal decongestants can be helpful if used for no more than 3 to 4 days. Antihistamines. Nasal decongestants and antihistamines are very useful. Topical nasal corticosteroids, nasal saline washes, and surgery. Precautions. Keep the humidity in your home at 55%. Avoid carpets to reduce contact with allergens. Clean your home regularly in order not to let dust accumulate on objects. Avoid smoking and secondhand smoke. Maintain a daily nasal cleaning routine with a saline solution. Thanks for watching. Please like, share, and subscribe, and hit the bell icon for more new updates. Meet you in the next video.